Women's health. New South Wales Health has an important role in helping women and girls to fulfil their potential at every stage of their lives. Many women and girls have different health and well-being needs and experiences that affect men and boys. Some differences in health and healthcare are driven by biological factors, such as those affecting maternity services and cervical cancer screening. Other differences are driven by gender-based roles, behaviours and attitudes affecting how women and girls access and experience services, both directly and as carers for others. New South Wales Health is providing services and programs targeted to addressing the health needs of women, including reproductive and sexual health, including termination of pregnancy, healthy lifestyles, chronic disease, mental heath, screening, for example, for cervical cancer, tobacco, alcohol and drugs, sexual assault and domestic violence, menopause funding and services, One in 5 women experience severe or prolonged menopause symptoms, but not all women are able to access health support. Funding for 16 holistic menopause services across New South Wales with a budget of $40 million from the 2022-23 New South Wales budget was announced in June 2022 by Minister for Women Bronnie Taylor. Cervical screening. A cervical screening test every 5 years is the best way to prevent cervical cancer. Learn more about how cervical screening saves lives. Cervical cancer is one of the most preventable cancers. Having a cervical screening test every 5 years is the best way to prevent it. The cervical screening test prevents cervical cancer by looking for the presence of the human papillomavirus (HPV). Almost all cervical cancers are caused by HPV. HPV is a common infection, passed through sexual contact, which usually clears up by itself in 1 to 2 years. If you are aged 25 to 74, have a cervix and have ever been sexually active, it is recommended that you have a cervical screening test every 5 years, even if you have had the HPV vaccination. In December 2017, the cervical screening test replaced the Pap test, sometimes called the Pap smear. This improved change supports the aims of the National Cervical Screening Program to reduce the number of cervical cancer deaths by encouraging more women to get screening. By working together, we aim to eliminate cervical cancer by the 2030s. Self-collection is now available for cervical screening. You can choose to collect your own sample for a cervical screening test. This option is called self-collection. Learn how self-collection works and find out if it is right for you. About the cervical screening test. A cervical screening test every 5 years could save your life. Learn more about the test and how you can reduce your risk of cervical cancer. What is the cervical screening test? The cervical screening test is a quick and simple procedure that looks for an infection called human papillomavirus (HPV). The test is performed by a doctor or nurse. You also have the option to collect your own sample for a cervical screening test. This is called self-collection. Learn more about self-collection and talk to your doctor or nurse if you are interested in this option. Why is it important? Almost all cervical cancers are caused by HPV infection that does not clear up. Most women with an HPV infection will not have symptoms. If an HPV infection does not clear up, it can cause cells in the cervix to change. In rare cases, these cell changes can develop into cervical cancer, usually over a period of 10 to 15 years. If you're aged between 25 to 74, have a cervix and have ever been sexually active, getting the cervical screening test every 5 years protects against cervical cancer. More than 70% of cervical cancers occurred in women who have never been screened or are not up to date with their cervical screening. How does screening prevent cervical cancer? Regular cervical screening prevents cervical cancer by detecting HPV. If HPV is found, the test looks for any cell changes in the cervix. Almost all cervical cancer is caused by persistent HPV infection that goes undetected. Regular cervical screening identifies women and people with a cervix who have HPV and are at an increased risk of developing cervical cancer. These women can be monitored and have further tests and treatment, if necessary. In the small number of cases where cervical cancer is detected, early diagnosis through screening greatly improves the chances of treatment being successful. All important link will be posted on description.